Hey everyone, and welcome to another deep dive. We're going to be digging into open source healthcare today. Seems like you're all pretty fired up about this one, and honestly, so are we. We've got some really fascinating articles from Co-Design Collaborative
Yeah,
and Metroport blog lined up. They really dig into why this is causing such a buzz and what it could mean for the future of, well, healthcare as we know it.
yeah, it's a pretty big deal. A lot to unpack here.
For sure. So picture this. A world where your health data just like flows seamlessly between any doctor, hospital, clinic, you name it. No more lugging around those giant envelopes of records, no more playing phone tag to track down test results. And honestly, that's just scratching the surface of what open source healthcare could unlock.
Yeah, it's a powerful idea, and it gets at some real pain points in healthcare as it stands.
Totally. And to really wrap our heads around this whole thing, I think it's worth looking at where things are at right now with healthcare in the US. Co-Design Collaborative doesn't mince words. They point out that, yeah, we've got pockets of amazing care, but the system overall, often pricey, super closed off, and as they put it, territorial. Kind of a harsh word, but
Well, it makes you wonder if they're not onto something. It's like every healthcare provider is doing their own thing with data. And that whole lack of interoperability, systems actually being able to share information smoothly, that's a recipe for trouble, big time.
huge. Co-Design Collaborative actually threw out this stat that kind of blew my mind. The U.S. wastes up to, get this, $77.8 billion every year. And why? Because healthcare IT systems can't talk to each other. We're talking billions with a B down the drain. Think about what we could do if even a chunk of that money went towards actually getting these systems to play nice.
And that's where this whole open source thing gets really interesting. It's not just about saving money, though Metroport blog makes a strong case for that, don't get me wrong. It's about changing the whole way healthcare data gets shared, how we access it. It's fundamental.
So instead of this software that's owned and controlled by one company, kind of like a walled garden, open source is more collaborative. Think of it like Wikipedia, but for software, right?
Hmm.
Anyone can contribute to the code, share it, even tweak it. And that openness, it opens up a world of possibilities for healthcare.
Absolutely. When you've got systems built on these open standards, sharing info is a breeze. No more data silos, no more waiting for faxes or trying to decipher what the doctor scribbled down.
And get this, Metroport blog uses this phrase, immortal code, which really stuck with me. Basically, even if a company goes belly up, the code lives on. No more being stuck with one vendor, no more systems crashing because one company decided to shut things down. It's about building a healthcare system on something that's stable and always getting better.
And because anyone can look at the code, it creates this transparency, this accountability that you just don't get with closed source software. You've got this global community of developers all looking for issues so systems get more secure, more reliable. It's a beautiful thing.
It's like having a million eyes on the code, making sure nothing shady slips through.
Mm.
Okay, enough theory crafting for now. Let's talk about what open source healthcare actually looks like in action. Real world examples. Hit me.
Co-Design Collaborative has some really cool case studies. One that caught my eye was GoInvo. They're all about making electronic health records, those EHRs, better.
EHRs. Oh, yeah, those things. Doctors love to hate them, right? Not exactly known for being user friendly.
Exactly. And GoInvo is tackling that head on. They've made their design policy open source, so it's like an open invitation for developers to create EHR systems that are actually intuitive, more efficient, better for doctors, better for patients. Everyone wins.
Love it. Making tech work for us, not the other way around. What about tools being built from the ground up with open source in mind?
Another great example from Co-Design Collaborative is HGraph. It's a visualization tool that takes all that complex patient data, the stuff that makes your head spin, and turns it into something you can actually understand, visuals. Imagine doctors being able to spot red flags, see patterns in a patient's history, just like that.
Whoa, that's like a superpower for healthcare. No more digging through endless charts and spreadsheets. Doctors can get the info they need instantly. It feels like we're on the cusp of something big here, a total game changer in healthcare.
We are. We really are.
Yeah.
But it's important to remember that even with all this potential, there are still some hurdles to overcome.
Right. It's easy to get caught up in all the exciting possibilities, but we got to be real about the challenges, especially with something as sensitive as, well, our health data. Yeah.
And let's be honest, one of the biggest concerns has got to be data privacy and security. If we're talking about making this information more accessible, more shareable, we need to know, with absolute certainty that it's not going to end up in the wrong hands.
Absolutely. It's one thing for doctors to be sharing medical records, but we're talking about a future where that same data could be flowing between researchers, insurance companies, maybe even tech developers, right?
And that's exactly why this whole open source thing hinges on having rock-solid security. Think, like, encryption's so strong that even if someone got into the system, the data would be meaningless without the decryption key, like it never happened.
Okay, so we're talking about a digital vault, multiple layers of security, the whole 9 yards. But then how do we make sure only the right people have the keys to that vault? That feels tricky.
Well, that's where something called granular consent management comes in. Co-Design Collaborative talks about this, and honestly, it's a game changer. Imagine being able to decide exactly which parts of your health data get shared and who gets to see them.
So, like, I could give my primary care doctor access to everything, but maybe a specialist only gets my lab results. Is that what we're talking about here?
You got it.
Yeah.
You're in control. You decide who gets to see what and what they can use it for. And it goes beyond just doctors, too. Imagine giving temporary access for a research study, or even being able to revoke access if you change your mind later on.
That level of control is almost hard to imagine right now. I mean, right now it feels like patients have almost zero say in how their information gets used. It's kind of unsettling if you really think about it.
It is. And honestly, it's a conversation we need to be having now, especially as we move toward a more open and connected healthcare system. But it's not all about tech, is it? We need to give patients the knowledge, the tools to navigate this new landscape. They have to be a part of it.
You're preaching to the choir here. We can build the most amazing systems in the world, but if patients don't know how to use them, if they don't know their rights, it's all for nothing. It's like giving someone a smartphone without telling them how to make a call. What's the point, right?
It's about creating this culture of digital literacy around health data. And that takes a multi-pronged approach. Easy-to-use interfaces, education, ongoing support so patients feel empowered, not overwhelmed.
It's a tall order, but the payoff could be huge. So we've talked data privacy, patient empowerment. What else should be on our radar as we explore open source healthcare?
Well, we have to talk about data ownership and control.
Yeah.
As we move away from these siloed systems where every provider is like king of their own data mountain, we need to figure out, like, legally, who controls the data in this new world.
That's a really good point because open source is all about shared responsibility, shared ownership, right? How do we guarantee that data stays secure, stays accessible, even if a company that's been working on the platform shuts down?
It's a valid concern, and it really highlights the need for some serious legal frameworks, some airtight licensing agreements. Open source doesn't mean anything goes. It's about setting clear rules that protect patients, ensure data integrity, and hold everyone accountable.
So it's about finding that balance between being open but staying secure, collaborating but maintaining control. It's a delicate dance, for sure, but one we have to get right if open source healthcare is going to really take off. It's like we're building a brand new house for all this health data, right? Got to make sure the foundation is rock solid.
Exactly. Got to support all the potential, all the possibilities we've been talking about.
Couldn't agree more. So we've covered data privacy, patient empowerment, the need for like clear rules of the road. It's a lot.
It is, but they're the tough conversations we need to be having. You know, if we want to get this right, if we want open source healthcare to actually benefit everyone.
100%. Speaking of the future, I think it's worth zooming out for a sec, looking at the bigger picture. We've talked about the potential here, but what about the broader, I don't know, implications? How could this change healthcare as we know it? Big picture stuff.
Now that's where things get really exciting. One area I'm super pumped about is medical research. Imagine if researchers had access to like massive amounts of data from all over the world, all de-identified, of course. It could revolutionize how we study diseases, come up with new treatments, even just understand those big health trends globally.
It'd be like unlocking all this medical knowledge that's been, I don't know, hidden away in these data silos for who knows how long.
Exactly, and it goes beyond research too. Think about public health initiatives. More data means tracking infectious diseases better, spotting those health disparities faster, creating public health programs that actually target the right people, the right problems.
It's like giving public health officials this real-time view of, like, the population's health, right? So they can jump on those emerging threats way faster.
Exactly. And let's not forget about innovation in general. Open source healthcare could unleash this wave of creativity. Developers from all over the place working together on new tools, new apps. We could see AI-powered diagnostics, personalized medicine platforms, all built on shared knowledge, open collaboration. The sky's the limit.
It's like throwing the doors wide open for healthcare innovation, right? The best minds everywhere working together to, I don't know, create a healthier future for everyone.
Couldn't have said it better myself. But like we've been saying, we got to be realistic about the challenges and, just as importantly, the role of regulation. You touched on this earlier. It could make or break the whole open source movement in healthcare. You know what I mean?
It's the big question mark, isn't it? Are governments going to get on board with this whole thing, create policies that help open source healthcare thrive? Or are they going to stick with these outdated rules that just stifle innovation and hold everything back?
Time will tell, I guess.
Yeah.
But one thing's for sure, the decisions we make now, they matter. They're going to have a huge impact on the future of healthcare. It's on all of us, patients, providers, policymakers, innovators, to make sure technology actually helps people, healthcare is accessible to everyone, and the whole thing is built on collaboration, on transparency. Those have to be the guiding principles, no question.
Couldn't agree more. Powerful stuff. Well, that was quite a deep dive into open source healthcare. We covered a ton of ground, everything from the nitty-gritty details to the ethical stuff to the potential impact on the future of, well, everything.
It's been great, really thought-provoking. And I think the biggest takeaway here is this is just the beginning. Open source healthcare is still young, but it has the potential to be huge, a real game changer. But we got to approach it the right way with, equal parts enthusiasm and caution.
Absolutely. On that note, one last thing to chew on. We've talked about how open source could make healthcare more affordable, more efficient, more patient-centered, all that good stuff. But as we move toward this, interconnected future, I think the real question we got to ask ourselves is, who benefits? Who actually gets to reap the rewards of these advancements?
The million-dollar question right there. It's about equity. It's about access. It's about making sure these technological leaps don't leave anyone in the dust.
Well said. As we, venture into this uncharted territory, it's on us to make sure healthcare serves everyone. That's it for our deep dive into open source healthcare. We hope this has given you plenty to think about. Until next time, stay curious.